Good afternoon, everyone. My name is Jess Smith Amara. I'm a full-time quality manager working in managed care. With me today on the team is Bet Wong, a retired OR nurse. We are actually both willing and able and anxious to get back to clinical practice, but are currently unable to find a feasible path back to the bedside. Nursing is expected to see demand rise at least 5% across the country over the next 5 years, while an estimated 900,000 nurses will leave the profession. We are going to talk to you today about technology assisted establishment of a reverse pipeline nursing model. Next slide. A clearly defined path for the reverse pipeline does not exist. While the initial linear pipeline of nursing school to bedside is well established, retired nurses like Bet or nurses like myself that work outside of the clinical setting do not really have an avenue to return to flexible and compensated clinical work. Current return to work recruitment solutions largely consist of casual or per diem work or contract nursing, but these solutions are prohibitive since they require working full shifts. We propose that the reverse pipeline can really be optimized through a gig app approach and a team nursing framework for rendering a match of highly technical and skilled nursing services for facilities in need. In this model, facilities can find nurses to complete services such as wound care, trach care, and PICC line care. A hospital in need of a nurse with expertise in, say, dialysis or ECMO can match with a nurse with those skill sets. A hospital with poor readmission rates impacting their value based reimbursement can find a nurse with expertise in patient education to reduce readmissions. Next slide. On the screen is the app process flow. I know that print is a little bit small. First, the facility identifies a need and creates a request that includes requirements and timeframes. After publishing the request for bids, we envision that nurse candidates will access the app and decline or bid on the request for nursing services. We acknowledge that logic and parameters will need to be established for hospital administrators in these bid requests, as well as eligibility requirements for use of the app. Next slide. A couple notes here related to achieving stakeholder buy-in. There is potentially substantial ROI for facilities changing staffing models to accommodate gig work and the completion of skilled nursing services rather than a focus on shift care and looking at that skill matching while decreasing their overtime and travel nursing costs. This model prepares the nursing industry for younger generations who may, in fact, demand gig based work and not necessarily shift based work. This model places value on individual nursing services, which may help to champion policy changes around nursing reimbursement models or lack thereof. And lastly, our vision is that this model will tap into currently unrealized significant contribution of nursing services towards value based reimbursement metrics and actually revenue generation for organizations. Next slide. So we are a team of nurses and developers, and we ask you for your support today.